COVID-19 status in the country, but also other matters regarding the ministry. Today I would want to start off by talking about the field of cancer and what we're doing in the ministry. As you know, in the last few weeks we have been highlighting other conditions that have compounded the COVID-19 pandemic in the country. And we have observed that individuals with underlying conditions are more at risk not only of contracting the disease, but also succumbing to it at some point due to low immunity. One of these conditions is cancer. And yesterday we talked about other underlying conditions, including cardiovascular diseases, diabetes, but cancer is one of those underlying conditions that you often find in those who might succumb to the disease. Cancer has been slowly and quietly consuming our people. It is one of the most impacting diseases on our people and health facilities in recent times. Every household in the country has in one way or another been affected by this deadly disease. Recognizing the burden of cancer in the country, His Excellency the President on 1st August 2019 directed the ministry to develop a cancer policy to address the growing burden of the disease in the country. Today marks an important milestone in our fight against cancer in Kenya, and we are proud for the first time to launch the Cancer Policy 2019-2030. Alongside this policy document, we are also launching today the Breast Cancer Screening Pilot Report. The Cancer Policy document provides a framework on how to comprehensively manage the cancer burden in the country through systematic implementation of evidence-based interventions in the area of care. So these are two documents that we shall be launching at the end of this brief. The Ministry of Health has put in place deliberate efforts to improve access to cancer services in line with the Universal Health Coverage Agenda. Through the Managed Equipment Services, or MES, the ministry has availed X-ray, CT scan equipment, ultrasound, and mammography machines to the counties to boost cancer diagnosis. In collaboration with the counties, the ministry has established 10 county chemotherapy centers, which are all operational and fully functional. The ministry has continued to support these centers with appropriate cancer drugs, especially during this COVID-19 pandemic period, to ensure continued service delivery. This means that basic cancer care can now be accessed at a nearby county health facility. And I want to urge our cancer patients on active treatment, as well as those on follow-up, to embrace and utilize these services. With these cancer treatment and management centers, the number of Kenyans seeking cancer treatment abroad will also be reduced. Additionally, as part of the objective to upgrade cancer care services in the country, the ministry recently operationalized the Kenyatta University Teaching, Referral and Research Hospital, which has very modern facilities for cancer treatment and management. We are also in the process of establishing 5 additional radiotherapy centers at the Moi Teaching and Referral Hospital, Nakuru County Referral Hospital, Mombasa County Referral Hospital, Garissa County, and Kisii County. Focusing on the maxim that prevention is better than cure, The ministry also launched the human papilloma virus, or HPV, vaccine to prevent cervical cancer targeting our 10-year-old girls. And I therefore want to encourage parents to take their 10-year-old girls for this vaccination at their nearest health facility. This vaccine is safe, effective, and life-saving. To all women, I want to remind them that cervical cancer screening services remain available in our health facilities, and I want to appeal to all eligible women to visit their nearest health facilities for screening at least once a year. The ministry has also developed and disseminated the National Cancer Screening Guidelines to all the 47 counties, and I want to appreciate those counties that have continued to make use of these guidelines to prioritize improvement of their cancer screening services, including through continued dissemination to health workers. Ladies and gentlemen, pertaining to breast cancer, it is the leading type of cancer in Kenya, with about 6,000 new cases every year. It is for this reason that the ministry conducted a breast cancer screening pilot dubbed the Breast Health Awareness Campaign, whose report I will also be launching today. This pilot project will guide the scaling up of breast cancer screening services in Kenya. I want to appreciate the Nyeri County leadership, and particularly the Nyeri County Health Department, the Kenya Network of Cancer Organizations, and the General Electric Healthcare for the support they offered that ensured the completion of this pilot project. Indeed, as I have already stated, prevention is better than cure, and embracing screening and wellness checks at individual level is what will make the difference in the fight against cancer and other non-communicable diseases in general. These diseases are silent killers, and more often than not, their symptoms will usually appear when it is already too late. Let us remember that most cancers are curable, particularly if they are detected early enough.